is Nancy Jansen. She is a nurse practitioner and the director of the Graham Health Center at Oakland University, joining us now on the Oakland County MegaCast. Nancy, thank you for being with us today.
Well, thank you for having me.
Appreciate having you on over the course of the pandemic. How are you? How's your team at the Graham Health Center?
We're all doing well. We're all busy, but we're all doing well. Thank you for asking.
So it has been a busy time for the entire medical community. We obviously thank everyone involved on the front lines and those that are on the second lines even and third lines down who are working on combating this issue on the local level, on the state level, and on the national level. So according to my notes, you have been preparing Oakland University's health outreach efforts since the beginning of this pandemic. What sort of work has that entailed? How has Oakland University and the Graham Health Center been working on outreach efforts in fighting the pandemic over the course of time?
Well, we're getting our campus ready. We've put in quite a few changes and protocols that should help reduce the risk. Some of these changes include a daily health screening that students, staff, and visitors must complete that will really indicate whether they are having any symptoms of COVID or have been exposed to COVID. We're also having students and staff take a daily pledge that they will follow the important daily behaviors that keep us all protected. We are ensuring that everybody wears a face covering while on campus. That's very, very important. And we are also, having signage put up around campus to enforce these important behaviors, not only the face mask, but social distancing and hand washing. We've ensured that the classrooms, the desks are 6 feet apart, that and in housing, there's less density for students living on campus. We have enhanced cleaning measures as well. And also we have testing for students that will be living on campus. So we've been busy getting prepared.
Something that made news this week was Oakland University's availability of what are known as bio buttons. It's optional for students, as was reported. They can wear these buttons that are tracking various health measurements and helping the university, in this case, track how COVID-19 maybe is impacting the student body. Helps, of course, with contact tracing. Do you have any details on why these bio buttons may be more effective in tracking tracking coronavirus information on Oakland University's campus, and why it may be beneficial for students to opt in to using these devices?
Well, this is just the use of technology in order to track symptoms, very similar to answering the daily health screening questions. So, being a university, we want to be on the forefront of testing new ideas and new technologies. So it is pretty exciting. And but the ultimate success will really be based on the student's behavior. So that's really what's going to determine how we keep our risk low.
You've been working in college health advocacy for a long time. How's this year been different? Have you ever experienced anything quite like what we're seeing now during the pandemic? And how will this help in your advocacy for health advocacy in the future?
That's a good question. Very good question. I started my career, actually, I graduated from Oakland University many moons ago. And when I first started at the public health department, I was on the forefront of the HIV epidemic. And that brought many challenges to the healthcare system and society. And I do, recall going through that and how it's so difficult for everyone to adapt to these new behaviors. I remember when I was a graduate nurse, we didn't wear gloves drawing blood and giving shots. And we had to make that one change as well as many others. So right now we all have to adapt to new behaviors to keep everybody safe. And it is a unique challenge for this generation, for the young adults. But I know that they're up to that challenge, because I know young adults, college students, and many people, they do care about people around them. One thing I would say is, when I see patients here in the clinic, students, if they're sick with an infection like strep throat, whatever, they would often ask, well, should I not go to class so I don't make other people sick? That's a common statement. And that just showed me every day how much students care about each other. So I know now with this, this pandemic, that I know students will be up to the challenge to wear a mask, stay 6 feet away, wash their hands. And also they need to stay home if they're sick. That's very important. And they also need to be sure to cooperate and answer the phone, because it could be somebody calling them to either tell them that they may have been exposed to COVID and might need to quarantine, or they could be waiting for their test result and find out they're positive, and then they need to to help the professionals at the health department, the professional contact tracers, reach out to their potential contacts, always very confidential at the health department. They never use names, but it's important that everybody cooperate with answering these important questions, so we can really limit the spread of any infection on campus and anywhere in the community.
Nancy Jansen, thanks again so much for being with us today. Erica Jones here, and I'm wondering, obviously we want to keep students in the classroom as much as possible, safely, socially distanced, but I'm a college student as well, so I understand that this is very difficult. Does Oakland University have a specific number or percentage of cases that you would need to reach in order for the administration to say, this is too much, we need to shut down campus completely, we cannot have students? Or is it kind of just a play it by ear situation? Are there hard are there hard numbers on that?
Well, you have to remember, it's not about a number, because if you just pick a number, any number, once you reach that number, what if it took you a whole year to get to that number? Let's say 50. Well, after a year or two, it's 50, then you close down. I mean, clearly that you can't have a number. But what are some of the parameters are the rate of infections, the ability, the capacity of the healthcare system, both a Graham Health Center and local hospitals, to provide care, and also for students to be quarantined and isolated. What's the capacity, at the university? Although we do really insist that students who live on campus who are sick or in quarantine go home, where they can be monitored by their family and by their primary care provider. So we don't have a magic number. It's more of a group of indicators.
Nancy Jansen with us. She is a nurse practitioner and the director of the Graham Health Center at Oakland University, with us on the Oakland County MegaCast. So, Nancy, if someone does test positive, if a student does test positive at Oakland University, as we come back in the fall or even in the present day, what is the Graham Health Center's protocol beyond that test? What are the next steps that happen after someone does test positive and those results come back?
Right. Well, first of all, we want to make sure that that student is doing okay and that they are under care. They may have come to us for care, or they may have been seen outside of Graham Health Center, but we still contact them to make sure they're doing okay, and to know and to make sure they understand what are the red flags and when do they need to worry, so that they have to get maybe emergency care. Because people can have this infection and be doing okay, and then one day having some difficulty breathing and need to go for emergency care. So their condition can change quickly. So we want to make sure they understand that. And we do want to make sure that if they live on campus, that they do go home and be monitored by their family and their own primary care provider. We also make sure the health department is alerted, and the health department completes the interview, and so that these professionals can reach out to their contacts confidentially and make sure that those contacts quarantine themselves for a full 14 days. And, we do offer care here for anybody who is positive as well. So those are some of the basic concepts.
Nancy Jansen with us. She is a nurse practitioner and the director of the Graham Health Center at Oakland University with us on the Oakland County MegaCast. Nancy, do you have any messages for students, maybe parents or others who are watching and listening today or watching on demand as they prepare to send their children back to OU or to other institutions?
I would like to say that, we all need to trust the science. And that means that we should, when the COVID vaccine comes out, I think it's really important that we all get vaccinated. And I hope to have that vaccine as soon as we can obtain it. But prior to the COVID vaccine, I encourage every student and staff, faculty on campus to have a flu vaccine as well. Flu has very similar symptoms to COVID. And flu can also, have very serious outcomes for young adults. And we had many cases of the flu last year. So we are a bit worried about the flu making a big comeback and having people with fevers, sore throats, and coughs around campus. Beside the flu, meningitis vaccine is very important. There's a new meningitis vaccine that came out a few years ago, and it's safe and effective, and many students do need that vaccine as well. They can get all these vaccines plus many more at Graham Health Center. And that's an important step to take in preparation for coming to campus, whether or not you're going to be living on campus, is to be sure to get vaccinated and trust the science. It is it's settled. The science is settled. Vaccines are safe and effective.
Ideally, all students that do test positive for COVID-19 will go home and be with their families and have care there, like you said. But what about students that live on campus who may come from out of state or have other conditions where it's not so easy for them to just go home and be with their families or anyone they may live with? Is there a plan for those students? Is there anywhere set aside for them to quarantine?
Yes. We have areas that are prepared for students to quarantine and isolate here on campus. Of course we do. Absolutely. And we understand that can happen. And we're ready to provide care for these students as well. So hopefully we'll have very, very few cases on campus. And it really, depends on all of us working together to protect each other. And I think, to me, one important way of thinking about it is if we all pretend in our heads that everybody we come in contact with has COVID. Just put that in your head. Everybody has it, and behave that way. We will get a handle on this, and cases will go way down. It's a simple concept, but I think that's one way of really, thinking and acting every day.
Nancy, for people that are being cautious, for students, even faculty that are being cautious on campus, as more people are coming back to campus in the fall than maybe have been there in the summer, are there testing sites available? Is there testing available at Oakland University? Obviously, there's plenty available in Oakland County through the health department, but are there going to be any for those that want to limit the number of spaces they go to get tested on campus?
Absolutely. Graham Health Center is prepared to test students with symptoms, or maybe those that have had a recent known exposure. We do have rapid testing, and we do have the testing the PCR testing, which is more sensitive and is more accurate. So we do have both. We use those, however, only for students with symptoms or have a known exposure. We don't do here in the clinic screening for those without any symptoms. We do refer those students out to other testing areas nearby. There's many of those, especially Oakland County Health Department.
Nancy Jansen with us. She is the director of the Graham Health Center at Oakland University. Oakland University, our Facebook partner today on this OU Friday on the Oakland County Megacast. So Nancy, circling back as we have a few more minutes with you to the flu vaccine. You suggested that all students get their flu vaccine this year, and with the symptoms being as similar as they are in some cases to COVID-19, and with COVID-19 still expected to be an issue without a vaccine through the end of the year, is this year more critical than ever for people to get those flu shots?
Oh, absolutely. And we are prepared to have a lot of pop-up clinics here on campus. The School of Nursing is collaborating with us and helping us set up these clinics, and we're going to be providing no-cost vaccination to students, and we'll be out and about and really encouraging that. So it is really, really critical. We had a lot of flu cases last year, and students, a lot of them were very sick with the flu, and they missed at least a week of classes, had to make up those classes. It's just miserable. So it's so critical to prevent the flu. And I think when you prevent the flu, this year especially, you're going to prevent the fear of, is it the flu or is it COVID? It's going to take us as providers some time to do some testing. What is it? Which one is it? And it's going to be more challenging for us. So if you get the flu vaccine, that really helps eliminate that risk. And I strongly encourage everyone to get it. I always have a flu shot every year. Everybody in my family does. Last year, we administered well over 1,000 doses of flu vaccine, and I never had one student complain of a side effect or any concerns about it. So it is safe and effective, and we will be out there in force providing these vaccinations to the students. And I certainly hope they take a flu vaccine.
Nancy, we're getting so close to students moving back onto campus at Oakland University and other institutions, but in particular at Oakland University, what is the university, and with of course, great help from the Graham Health Center on campus, doing to get students ready to come back to campus in terms of communication, in terms of educating them on the protocols and so on? What is the Graham Health Center and Oakland University doing to prepare these students to come back to campus in the fall, or to come to campus in the fall for the very first time?
I know that our website, Oakland University website, has a back to campus, very robust communication page, and I would encourage the students to go there and keep referring back to that for any updates. And there's regular communication to students, especially those that are going to be living on campus, in regards to testing, because we will be doing testing of students that are going to be living on campus. So there's a lot of communications going on with that. And as I said before, there's signs around campus, and we're going to be providing students, when they move in, a health kit that'll have a lot of information about COVID, a lot of a mask, a thermometer, and so forth. So we'll be doing that as well. So there'll be a lot of ongoing communications.
Nancy, just another couple minutes with you. Nancy Jansen, the director of the Graham Health Center at Oakland University. Before we let you go, is there anything else that you'd like to touch on today, or any other important information that students or families of Oakland University, even faculty coming back in the fall, should know?
We have to all work together. It's about personal responsibility, and it's about caring for others. That if one person doesn't follow these important protections, these layers, it's almost like we have layers of measures put in, not one of which is perfect. Just wearing a mask is not perfect. Just staying 6 feet away is not perfect. Just washing your hands is not perfect. But if we all do these all the time, it will go a long way to really reducing the number of cases. And I know that nobody wants to be the one to say, oh, I didn't stay 6 feet away, I didn't wear a mask, and then I contracted COVID and I gave it to my friend who gave it to his grandmother and his grandmother died. I know nobody wants that, but we have to remember that those are the things that can happen if we're not all every minute of the day following these important guidelines. So I know the students can do it, and I know they want to do it. We just have to all remind each other, or make it a social norm to do these important things. We have to trust that this is the best way to go right now until the vaccine comes out. But even when the vaccine comes out, these behaviors will need to stay in place.
Well, Nancy, we appreciate having you on with us today.
Well, thank you for having me.
Thank you. It's been a pleasure. Nancy Jansen, she is the director of the Graham Health Center at Oakland University, with us on the Oakland County MegaCast.